Hello everyone, I'm Dr. Adhd. I'm a consultant psychiatrist and a psychologist. I make videos on mental health education and self-improvement tips. My goal is to help demystify mental illness and provide you with tools that will help you be your best and live your best. On today's video, I will be talking about attention deficit hyperactive disorder. It's sometimes called attention deficit disorder, or for short, it is referred to as ADHD or ADD. It is a neurodevelopmental disorder that affects both children and adults. This is the first of a three-part video on attention deficit hyperactive disorder. On this particular video, I will be focusing on the myths and the facts about attention deficit hyperactive disorder. The first myth is that ADD is not real or ADHD is not real. Some people believe it's just an excuse people give for being lazy or for lacking discipline, and that is not correct. As far back as the 1980s, ADD or ADHD had become a recognizable medical condition. It is said to affect about 2 to 7% of the general population, ranging from children to adults. Males are more affected than females. Among children, you have a ratio of 3 to 1. Then among adults, you have a ratio of 2 to 1. That's male to female ratio. Now, in the past, it was more looked at as a behavioral problem. But now research is pointing towards the direction that maybe it has more to do with the executive functioning of the brain, which is observed by the frontal part of the brain. So it is a recognizable medical condition. The second myth is that ADHD is caused by poor parenting, excessive watching of TV, increased sugar levels, some food additive, or too much watching of laptops. This is absolutely wrong. ADHD is a neurodevelopmental disorder. The actual cause of this condition is unknown, but the fact that it's a neurodevelopmental disorder simply suggests that the problem probably occurred during the perinatal period, which simply means the period during pregnancy and the period just after delivery. Now, some clear risk factors have been shown by research in varying degrees, top of which is hereditary factor or a genetic factor. 70 to 80% of people with ADHD have a family member, whether diagnosed or not, with similar condition, meaning that ADHD is more of nature rather than nurture. Other varying factors that have been associated with ADHD include high level of lead in the blood, 2, smoking cigarettes or use of alcohol during pregnancy, 3, prematurity births, preterm births, and 4, significantly low birth weight at the time of delivery. And last but not the least is any assault or injury to the prefrontal cortex of the brain. So any assault that affects the head, the frontal region of the head, and invariably the prefrontal cortex of the brain may increase the risk of having ADHD. This is important because the prefrontal cortex of the brain is the part of the brain that is responsible for executive functioning and decision making, which is something that is clearly seen in the symptoms of ADHD. The third myth and the last myth that I'll be talking about on this video is the fact that ADHD can be simply diagnosed by just doing a simple test. Now, many times people just go online and just find a simple test and just say, oh, I have ADHD. Now, it is a bit more complex than that. To make a proper diagnosis, you may need to engage the help of a psychiatrist or someone who is trained to make that diagnosis, because it will entail a lot of questions that span across different aspects of your life. So just doing a simple test online may not cut it and may not be sufficient to make a proper diagnosis for ADHD. And let me just throw this in there. So it's also not wise to just say to someone else that have been diagnosed with ADHD, then you just say, okay, I think I also have ADHD because I read it online, I think I have the symptoms, and I've done the self-help test online, and I think I have the symptoms, so let me just go ahead and take the medication. The medication is not safe, and it's actually against the law to just take someone else's ADHD medications and just start using it without it being prescribed to you. So there you have it. These are the 3 myths I would just like to talk about on this video. I hope this was helpful. Just in case you have not subscribed already, please go ahead and subscribe so that you don't miss any of our subsequent videos. Like I mentioned earlier, this is the first of a 3-part video on ADHD. I'm sure you will benefit from the others, and I'm sure someone else will. So kindly share this video. Thank you very much.